In the early 1700s, surgical procedures often resulted in high rates of post-operative infections. Conditions like sepsis and gangrene were common due to the lack of understanding about germ theory and the causes of infection. Surgeons operated with unclean instruments, and there was little to no emphasis on cleanliness. Although not yet widespread, there were early observations about the importance of cleanliness. Hungarian physician Ignaz Semmelweis, in the mid-1800s, discovered that hand-washing with chlorinated lime solutions significantly reduced puerperal fever, childbed fever, in obstetric clinics. Despite the resistance and lack of understanding, his work hinted at the role of cleanliness in preventing infections. In the 1860s, French chemist Louis Pasteur conducted experiments that led to the development of the germ theory of disease. He demonstrated that microorganisms were responsible for fermentation and spoilage, leading to the broader understanding that these microorganisms could also cause infections. Inspired by Pasteur's work, British surgeon Joseph Lister began experimenting with carbolic acid, phenol, as a means to kill germs and prevent infections. In 1865, he successfully used carbolic acid to sterilize surgical instruments and clean wounds, dramatically reducing post-operative infections. Lister's method involved spraying carbolic acid in the operating room, washing hands and surgical instruments with it, and applying it to wounds. This practice, known as antiseptic surgery, marked a significant shift in surgical protocols and greatly improved patient outcomes. Despite initial skepticism, Lister's antiseptic techniques gained widespread acceptance by the late 19th century. The dramatic reduction in surgical mortality rates helped convince the medical community of the efficacy of antiseptics. The understanding of germ theory and the success of antiseptic practices led to further developments in sterilization. Instruments began to be heat sterilized, and the importance of maintaining a sterile environment in operating rooms became well established. The late 19th century saw the development and use of various antiseptic solutions, including iodine and mercuric chloride. These solutions were used to disinfect surgical sites, instruments, and wounds, providing more options for infection control. The introduction of antiseptic techniques significantly reduced mortality rates from surgical infections. This advancement made more complex and invasive surgeries possible, paving the way for modern surgical practices. The success of antiseptic methods laid the groundwork for the development of aseptic techniques, which aimed to prevent contamination from the start, rather than just eliminating it once present. This shift further improved surgical outcomes and patient safety. The recognition of the importance of infection control led to the professionalization of surgical practices and the specialization of roles within the surgical team, including the development of roles focused specifically on maintaining sterile conditions. The period from 1700 to 1900 was crucial for the development of antiseptics, fundamentally changing medical and surgical practices. From early observations about the importance of cleanliness to the pioneering work of Joseph Lister and the broader acceptance of germ theory, these advancements drastically reduced surgical infections and mortality rates. The evolution of antiseptic techniques set the stage for modern aseptic methods, revolutionizing the field of surgery and significantly improving patient care.